How do non-healing sores finally heal? Imagine a sore that just won't go away, no matter how much you try to treat it. Non-healing sores, also called chronic wounds, can be frustrating and concerning. They often happen because something in the healing process gets disrupted. To understand how they finally heal, we need to look at what normally happens when your skin repairs itself. When your skin is injured, the body kicks off a healing process that happens in four overlapping stages. First is hemostasis, where blood clotting stops the bleeding. Next comes inflammation, which clears out debris and bacteria. Then the body enters the proliferation phase, where new tissue and blood vessels form. Finally, tissue remodeling strengthens and matures the new skin. In a healthy wound, these steps happen smoothly. But in a non-healing sore, something interrupts this process. It could be poor blood flow, infection, too much inflammation, or cellular responses that don't work properly. Healing a stubborn sore involves several key steps. One important step is debridement, which means removing dead or infected tissue. This can be done surgically or with special dressings. Removing dead tissue helps get rid of biofilms, which are communities of bacteria that protect microbes and make healing harder. Infection control is also vital. Chronic wounds often harbor bacteria that keep inflammation going and damage tissue. Doctors may prescribe antibiotics or antiseptics to help control this. Maintaining the right moisture level in the wound is another critical factor. A moist environment supports cell movement and tissue repair, but too much moisture can cause maceration, which slows healing. Improving blood flow and oxygen supply is often necessary because many chronic wounds suffer from poor circulation. Treatments like hyperbaric oxygen therapy involve breathing pure oxygen in a pressurized chamber, increasing oxygen levels in the wound and helping it heal faster. Addressing underlying health issues is equally important. Conditions like diabetes, vascular disease, or pressure from prolonged immobility can impair healing. Managing these conditions helps prevent the sore from becoming chronic again. Sometimes, advanced therapies such as growth factors, skin grafts, or bioengineered tissues are used to stimulate healing when standard treatments aren't enough. From a skin health perspective, it's important to recognize that sometimes a non-healing sore can be a sign of skin cancer, such as squamous cell carcinoma or basal cell carcinoma. If a sore persists for several weeks without healing, it should be checked by a healthcare professional. A biopsy may be needed to rule out cancer. Early diagnosis and treatment are essential to protect your skin health. In summary, non-healing sores finally heal when the environment around the wound is optimized. This involves removing barriers like dead tissue and infection, improving blood flow and oxygen delivery, controlling inflammation, and treating any underlying health issues. Always seek medical advice if you notice a sore that does not heal, especially if it has unusual features or persists beyond a few weeks. Proper evaluation ensures that any serious causes, including skin cancer, are ruled out and that you receive evidence-based treatments that support your body's natural healing process.